Tomorrow you have embryology class. Okay, let's start. Today we are going to talk about the lymphatic system. You know that all the vessels in the body divided into two kinds, arteries and veins. The arteries are carrying the oxygenated blood, the blood with O2, with oxygen, to body tissues, and the veins will carrying the blood from tissue to the heart, and the blood which is in the veins is the deoxygenated blood. Okay? I have explained to you in our first session that the arteries are dividing and then they are forming the capillaries in each tissue. These capillaries had one layer of, for example, the end part of the tissues, the capillaries have one layer of the cells and also a basement membrane, a layer of a cell and a basement membrane. The tube, the inner diameter of each capillary is not very much, and it's so small with just one red blood cell can pass through these vessels. Okay, so the end arteries, or we can say the small capillaries, are have very small diameter, in the size of just, for example, one red blood cell. There would be some junctions between the epithelial, or it would be better to say endothelial cells of the capillaries. Okay? At the time when the plasma or the serum is moving inside the capillaries, some of the materials has to exit the capillaries and reach to the tissues. Some of the materials from the plasma should exit the capillaries and enter to the plasma. There is a fluid between the cells of each tissue, which is called the extracellular fluid. The materials in the extracellular fluid, all the time they are changing their materials with the materials in the plasma. Yes, we call that interstitial fluid also, or extracellular fluid. So the cells will give their waste products to the extracellular fluid and giving the needed materials from this fluid. Okay? The important materials are entering to the extracellular fluid from the vessels, from the capillaries. You know that the power of the blood pressure is much higher in arteries than veins. Okay? The blood pressure has much power in arteries compared to veins. So, if you think that, for example, the arteries, in the tissues which we have the capillaries, when the material and also the plasma is exiting the capillaries, the arteries, it has to return back into the veins. It has to return back into the veins. But the power of the veins is not enough. So because of that, there would be need for some other vessels to help the veins and carry the extra materials in the extracellular fluid. Okay? So, because the blood pressure in the veins is not enough for carrying all the materials and all the waste products in the extracellular fluid, there would be need for other vessels to help the veins. These kind of vessels are called the lymph vessels or lymphatic system. So the lymphatic vessels or lymph system are helping the veins to carry the waste materials and also the extra materials, the extra plasma of each tissue to the blood, to the heart. The fluid which is present in the lymphatic system is called lymph, and it is full of lymphocytes. So the lymph is full of lymphocytes. The lymphocyte is a transparent fluid. It's a transparent fluid. In the way of the lymphatic system, we have some lymph nodes. There would be some stations, and in these stations we have lymphatic nodes. Okay? The lymphatic nodes are are some kind of rich blood tissues, and some ducts, or we can say some, for example, like 8 to 10 ducts, will entering to each node, and just 2 or 3 ducts will exit each node. So they are receiving much lymph, and after that they will give the lymph into the ducts which are exiting these nodes. Yes, macrophages are the lymphocytes which are in the tissues, not in the blood. When they are exiting the blood, we call them macrophage. Okay, so they are consisting lymphocytes. Think that, yes, they are. I will explain all the lymphatic system, but they are draining into the heart. I will explain. Okay, now, if there would be an infection in the direction and in the way of the lymphatic system, this infection will enter to the lymph nodes. At the lymph nodes, listen please, at the lymph nodes, the lymphocytes most of the time would be able to solve the problem most of the time, okay? But think that, for example, there would be a cancer in a tissue, like liver, like spleen, or everywhere. The cancerous cells can enter to the lymphatic vessels and then enter to the lymph nodes. At the side of the lymph nodes, they are metastasizing. Okay? At the inside the lymph nodes, these cancerous cells are metastasizing by the mitose and proliferating. So there would be some cancers in lymph nodes. But the origin of the cancer were, for example, in somewhere else, like, for example, liver. Yes, they accumulate. They are proliferating in the lymph nodes. So, if we see a cancer in some lymph nodes of the body, we can follow the way of the lymph vessels to see where is the origin of the cancer. Think about the breast cancer. The breast lymph vessels are draining into the axillary nodes. So, if we see cancerous cells in the axillary nodes, we can guess that there would be a breast cancer. So this is one of the important points of the lymph nodes. Now, the lymphatic system, we said that has some lymphatic nodes in their way. The lymphatic nodes are mostly present in the anatomical spaces. The anatomical spaces are, for example, the axillary, the cubital, the inguinal, the popliteal spaces, and etc. Okay? These are some of the anatomical spaces. At first, we are going to talk about the axillary glands. The lymph which is coming from the hand and the arm and forearm are coming into the nodes which are present in the cubital space, supratrochlear. Okay? Cubital, or for example here we have supratrochlear nodes. After that, they are draining into the axillary glands. Axillary glands have some groups. 5 important groups of axillary glands are present in the axillary space. The anterior, or also called the pectoral group, is receiving the lymph from the breast, the anterior thoracic wall, the upper anterior abdominal wall, for example here. Okay? These are draining their lymph into the anterior node or pectoral nodes. The posterior or scapular nodes are receiving the lymph from the posterior thoracic wall, the tail of the breast, from here, for example, tail of the breast near the axilla, upper posterior abdominal wall. The lateral or axillary vein lymph nodes are receiving the lymph which are, these group are near to the axillary vein. Okay, they are present beside the axillary vein, and they are receiving the lymph from arm, forearm, and hand. Look at here, from arm, forearm, and hand to the lateral group. And the central group present in the center of the axilla and receiving all the lymph from anterior, posterior, and lateral group here. It is placed in the center of the axilla and receiving the lymph from other 3 nodes. The last group of the axillary group glands is the apical. The apical group is placed in the upper part of the axilla and receiving the central group, the lymph of the central group, and also draining its lymph into the infraclavicular group. And after that, they are draining into subclavian lymph trunk. subclavian lymph trunk. So, if, for example, we have cancer in the breast, we have to search, or the clinician have to search the axillary glands, and also they have to see that, for example, where is the metastase of the cancer. The supratrochlear, you mean here, the supratrochlear gland is placed in the cubital space. In the cubital space and receiving the lymph from the forearm and hand. Okay, from these sides and hand, and then drain the lymph into the lateral group of the axilla. So it is so important to explore the way that the lymph is coming from in cancerous conditions. Now, what about the inguinal glands? What about the lower limb? The first place for the lymph nodes in lower limb is the popliteal place or popliteal space. Okay, we have popliteal nodes in the popliteal space. After that, the lymph will drain into inguinal glands. The lymph will drain into the inguinal glands. There would be two groups of inguinal glands, superficial and deep inguinals. Or also we have, look at here, superior and inferior glands. The superior glands placed beside the inguinal ligament. Look at here, we have inguinal ligament from acies to symphysis of pubis to pubic crest. So we have the superior group of the inguinal glands here. They are placed likely in transverse, but the inferior group are placed in the way of the saphenous vein. Here we have the saphenous vein. Okay? And these are the inferior group. They are placed vertically, longitudinal direction. The inferior group is receiving the most lymph of the lower limb. The inferior group are receiving the lymph of the lower limb mostly, but the superior group, I mean this group, are receiving the lymph from the gluteal, the abdomen, the lower part of the abdomen, and back. Okay, they are receiving the lymph from these sides. But we said that the superficial and deep inguinal groups are also placed here. Most of the lymph from the perineal part is draining into the inguinal glands. Look at here, the superficial inguinal glands are receiving the uterine fundus via the round ligament, okay, from here. Skin of the penis, labia minor and scrotum, skin of the buttock, skin of lower abdominal to umbilicus, skin of the thigh, anterior skin of cuff and dorsum of the foot here, skin of the anterior prene. Okay, and The deep inguinal are receiving the anterior prenome, the thigh, leg, and foot. Okay? The deep inguinal are receiving the lymph, or for example, the lymph nodes which are combined with the deep vessels, deep veins, and the superficial ones are receiving the lymph nodes which are combining the superficial veins like saphenous. The popliteal group are also receiving the lymph from the skin of the sole of the foot and skin of the posterior cuff. After that, what will happen for these inguinal glands? Both. They both will drain their lymph node into the superficial inguinal glands. Okay. The superficial inguinal lymphatics drain via the saphenous opening into the deep inguinal nodes, okay? After the superficial inguinal nodes receiving the lymph from the spaces that I told you, they would drain into the deep inguinal nodes. And after that, then via the femoral canal to Klotz node. Klotz. Let me show you. Look at here. Klotz node. Here in the femoral canal, we have a lymph node which is receiving the lymph from deep inguinal node. And then it will drain into the internal iliac nodes. Then, look at here. After this node, we have the iliac and lateral pelvic nodes. It will drain into the internal iliac nodes. Here we have the internal iliac nodes beside the internal iliac vessels, and also we have the external iliac nodes besides the external iliac vessels. They both are receiving the lymph nodes from lower limb and the prenome, and then coming upward and forming the common iliac nodes. They are forming common iliac nodes. Here. Beside the common iliac vessels. Okay. After that, the lymph will enter to the abdomen. The lymphatic system will enter to the abdomen. We have some lateral pelvic nodes. Look at here, lateral pelvic nodes. And after that, they are draining into the common iliac nodes and coming beside the aorta. We have two groups of node beside the aorta. One is called para-aortic, or the other name is retroaortic group, para or retroaortic group. And the other group is pre-aortic. The pre-aortic groups are placed in front of the aorta, and para-aortic group are placed we can say lateral and posterior or behind the aorta. The para-aortic or retro-aortic group are receiving the lymph nodes of the wall of the abdomen. Of the wall of the abdomen. But the pre-aortic group are receiving the lymph from the digestive system. The pre-aortic, which are placed in front of the aorta, are receiving the lymph from the digestive system. Yes, pre-aorta. Pre means in front of. What are the most important systems which are draining their lymph into the pre-aortic groups? The inferior mesenteric, the superior mesenteric, and the celiac. Inferior mesenteric beside the inferior mesenteric vessels, which are draining the lymph from, for example, the upper part of the rectum, the sigmoid, and this part. Superior mesenteric from the transverse colon, the ascending colon, and the small intestine. We call that also intestinal group. And also the celiac from left gastric, epigastric, splenic, and hepatic system. We said that the lymph is a kind of transparent fluid. But the lymph which is coming from the digestive system is full of lipids, oil, okay? The lymph which is coming from the digestive system contains oil or lipids. So its color is a kind of milky. Its color is kind of milky. So they are also called the luteal ducts. Yes, lipid. So the system or the ducts which are coming from the digestive system also called the luteal ducts. After that, yes, pre-aortic, which are receiving the, yes, luteal, from the digestive system. Okay? So, after receiving the pre-aortic and para-aortic ducts, these ducts will drain into a place which is called cisterna chyli. Cisterna chyli. Here. In the abdomen, we have cisterna chyli, which is receiving the pre-aortic and para-aortic system. The cisterna chyli is not present in 30 to 40% of people. Okay? It is not present in 30 to 40% of people. It's a variation, and it's just a duct, not a cistern. In them, it's just a duct. It's not a cistern. Okay? After that, the lymph will enter to the thoracic cavity. The lymph will enter to the thoracic cavity. And its name would be thoracic duct. No, it's just a cistern for the lymph. The cisterna chyli is just a cistern for the lymph. Not a special function, no. Now, after that, the lymph will enter to the thoracic cavity and its name will change into the thoracic duct. Here we have the thoracic duct. Thoracic duct is placed between the aorta on its left side and the azygos on its right side here. Thoracic duct is placed on between the aorta on its left side and right side azygos. It's between these two. Near the fifth thoracic vertebra, the thoracic duct will change its direction and almost going to the left side. Can you see? At the level of the fifth thoracic vertebra, it will change its direction and going to the left side, almost. So, it will pass behind the esophagus at the upper part of the thorax. It will pass from behind the esophagus and the apex of the left lung. Why they change his direction? I don't know why, because at the end, thoracic duct want to drain its lymph into the venous system. Okay, so it will go into the left side and place behind the esophagus and the apex of the left lung. And enter to the neck. Okay, here we have the neck. In the neck, it will go upward. Listen, it will go upward in the neck and then again has an arc and coming down. Here we have an arc and coming down and drain the lymph into the junction of the internal jugular vein and the left subclavian. Look at here. It will go upward in the neck and make an arc, then come back and drain the lymph between the junction of the left subclavian and internal jugular vein. The thoracic duct, in the thoracic cavity, we have some lymphatic drainages. One of them are beside the internal thoracic arteries. Okay? One of the ducts in the thoracic cavity is called the parasternal group. The parasternal ducts are placed beside the sternum and the internal thoracic artery and vein. They are receiving the lymph from the medial part of the breast and also the chest cavity. Also, we have mediastinal branches of the lymph. Mediastinal branches of the lymph, which are draining the lymph from the mediastinum and the heart and this. But what about the lungs? The first branches of the lymphatic system in the lungs is called the pulmonary ducts. Look at here. In the tissue of the lungs, we have the pulmonary ducts. After that, we have the bronchopulmonary branches. Here, we have the bronchopulmonary branches, which are draining the lymph node into bronchopulmonary nodes. They are into groups, superior and inferior, bronchopulmonary ones. After that, we have the trachobronchial nodes. Look at here. Trachobronchial nodes. At the side of tracheal bifurcation, we have the trachobronchial nodes. Inferior trachobronchial and superior trachobronchial nodes. After that, the lymph will drain into paratracheal at both sides, right and left, at both sides. After that, we have paratracheal nodes here, paratracheal nodes at both sides of the trachea. These are paratrachea. Yes, both sides, trachobronchial. All of these groups of lymph nodes are present in both sides, right and left. It's clear in this slide, okay? After that, we have paratracheal nodes, and at the end part we have the bronchial nodes. After that, we have the bronchial nodes. The paratracheal are draining their lymph into the bronchial nodes. The last part are the bronchomediastinal nodes. The bronchomediastinal nodes are draining the lymph at the end into the, for example, thoracic duct in the left side and the right lymphatic system in the right side. Here we have also the trachobronchial. We can see them. The thoracic duct is receiving the lymph from the left jugular trunk. Look at here. The left jugular trunk, the left subclavian trunk, I mean the left upper limb, the cisterna chyli, I mean the lymph from the abdomen, most thoracic lymphatics, all the thorax again. You can see the videos. Okay, most thoracic lymphatics except right upper thorax, except here. So you can see that most parts of the body are draining their lymph into the thoracic duct, except the right upper thorax, the right upper limb, and right side of the head and neck. Except these parts, all of the lymph will drain into the thoracic duct. Left jugular trunk, which is draining the lymph from the left side of the head and neck. Left subclavian trunk from left upper limb. cisternaculi from lower limbs and the abdomen. Most thoracic lymphatics, I mean the left thoracic side, to the thoracic duct. But the other branch is right lymphatic duct. Instead of thoracic duct, we have right lymphatic duct in our right side. The right lymphatic duct is receiving the lymph from right subclavian trunk, the upper limb on the right side, right jugular trunk from the right side of head and neck, and right bronchomediastinal trunk from the right upper side of the thorax. Yes, they all are at the root of the neck. And we can see that the right lymphatic duct is also draining the lymph into the side of the junction between the internal jugular vein and the subclavian vein on the right side. They both are draining their lymph into the junction of internal jugular vein and subclavian vein in the right side and left side. Okay? Here we can see the cisternaculi and the lymph from, for example, the descending thoracic lymph trunks. It's placed beside the descending thoracic aorta and making an arc and draining the lymph into the junction of these two. Bronchomediastinal lymph trunk, does it also at the, no, the bronchomediastinal lymph trunk is not at the root of the neck. It's clear from its name, it's placed in the mediastinum. Okay, the bronchomediastinal lymph nodes are placed in the mediastinum, between the lung and heart, we can say. Look at here. For example, here, upper left intercostal and mediastinal lymph trunks. Here we can see the mediastinal lymph trunks which are receiving the bronchomediastinal branches or lymph nodes. And they are draining the lymph into the thoracic duct. You're welcome. Okay, so this was the lymphatic drainage of the thoracic cavity. Let's have a rest and I will give you the link. Yes, one time is okay. Now, at the end, we will talk about the lymph which is coming from the head and the neck. We have some nodes in the head and the neck spaces. Some of these nodes are the circular nodal chain. Yes, really, human is so complex, and I think if you study the embryology, you will see that it is more complex than you think. I think, yes, it's the last slide. Yes. Okay. We have some circular nodal chains in the head and neck side. For example, submental or bilateral chains. Look at here, submental nodes, submandibular nodes, deep and superficial preauricular, deep here, and superficial preauricular nodes, also we call them parotid nodes, and retroauricular nodes here. These all are called the circular nodal chain because if you follow their direction, we can see they make a circle around the head in both sides. We call them circular nodal chain. Okay, submental in both sides, submandibular in both sides, preauricular in both sides, and also retroauricular and occipital in both sides. These are circular nodal chain. They are draining the lymph into other lymphatic veins. We call them deep cervical chains in the neck. For example, jugulodigastric nodes at the side of digastric muscle in the upper part of the neck. Then jugulo-omohyoid. Omohyoid is also one of the other muscles in the neck. Then we have retropharyngeal nodes behind the pharynx. Retropharyngeal nodes behind the pharynx, and also we have paratracheal at each side of the trachea. Paratracheal, you have seen them. The paratracheal. Also, we have some superficial chains. These are the deep cervical chains. Also, we have some superficial chains in the neck. All of these lymph from the superficial chain and also the deep chain are draining the lymph into the jugular lymph trunk. Jugular lymph trunk. And also the jugular lymph trunk is draining the lymph to this part and attaching to the right subclavian lymph node in the right side and to the left one in the left side, and they both are draining the lymph into the venous system. From the right side of the head and neck to the right lymphatic duct, and from the left side to the thoracic duct. The most important point of the lymph is in fighting with the infectious. Okay? The most important function and important point in the lymphatic system is in its fighting with the infectious. Think that, for example, something like a needle which is not clean is when, for example, you are walking or doing something, entering to your finger. After a long time, or for example a week, you feel pain in, for example, in the femoral pain or at the side of the inguinal ligament. The physician will ask you about the thing that happened to you because they can see that there would be an inflammation in the inguinal nodes. So maybe the infectious comes from, for example, feet, leg, or other parts. So they will understand that the lymphatic system has an infection, so doing something because of that. And also, as I said, in cancer conditions, they will find the cancerous tissue by following the way of the lymphatic system. They will understand, for example, the lymph is coming from liver, spleen, or somewhere else, and then guess which tissue has cancerous cells. So it is the importance of the lymphatic system. That was all the thing that we have to we had to know about the lymphatic system. If you have any question, you can ask, and if not, for tomorrow, for the next time, we will start the embryology of the circulatory system. Explain at the end about lymphatic drainage. I have told you that in tissues, for example, all the tissues, when the plasma is exiting the vessels, they will exchange the materials in the extracellular fluid. Okay? After that, after getting the waste materials, these fluid have to come back into the vessels, into the venous system. This process will happen in the venous system of the capillary veins, but because that the capillary veins are not so powerful like the arteries, there would be some other vessels to get and to get the extra fluid from the tissues. These vessels are the lymphatic vessel. They are draining the waste material from the tissue and extracellular fluid and entering that material, that fluid, into the venous system. Think that, for example, because of the breast cancer, somebody is doing a mastectomy surgery. Okay? You know, after the mastectomy, the physician will remove all the auxiliary nodes. I will explain, okay? The physician will remove all the auxiliary nodes. So, if this person, for example, that person, work hard with his or her upper limb, after some time, we can see a kind of, how can I say, inflammation in his upper limb. Okay? Because the auxiliary nodes and the lymphatic system is removed, so the extracellular fluid cannot return back into the venous system properly, so that will happen. We can see some inflammation in the upper limb. And the lymphatic system is connected mostly to the venous system. They are drainaging the lymph into the venous system. Yes, the removing is associated with the clinical points, yes. Because the cancerous cells also are present in the auxiliary nodes, for example, so they have to remove all the nodes to prevent metastasis of the cancer. Slide number 6, you said. I said the inferior mesenteric is draining the lymph from the parts where the inferior mesenteric artery is supplying their blood. For example, descending colon, sigmoid colon, superior or upper part of the rectum, and that. Superior mesenteric will drain the lymph from the intestinal, the small intestine, the transverse colon, and ascending colon, and some parts of the pancreas. And the celiac system is draining the lymph from the pancreas, the hepatic part, the splenic part, left gastric, and this. And all of them will drain into the cisterna chyli, the pre-aortic and then the cisterna chyli. I cannot give you the attendance link again. Sorry.